A very warm welcome to Global Healthcast COVID Special, a co-production between Global Health Press and the Coalition for Life Course Immunization, CLCI. This podcast was made possible through an unrestricted grant from Novavax. Our 6 COVID specials will cover epidemiology and surveillance, long COVID, COVID in children, vaccines and vaccination. I am Schmitt, and with me throughout the 6 COVID podcast specials will be Professor Catherine Weil-Olivier. Catherine, welcome and good morning, good evening, whatever.
Hi, everybody.
Our topic today is vaccine confidence in the context of COVID. And it is our great pleasure and honor that for this topic, we have with us as an expert, Dr. Emily Karafillakis. Hello, Dr. Karafillakis.
Hello, everyone. Nice to be here.
Dr. Karafillakis is a senior social scientist with almost 10 years of experience in international research and teaching in academia, currently leading European research at the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, and also at the University of Antwerp. With a background in public health, infectious disease control, and health system and policy research, her work focuses on understanding individual and group beliefs, attitudes, and confidence in health interventions, and assesses how these can influence public health control measures and health promotion strategies, including vaccination. Dr. Karafillakis has extensive experience on issues of vaccine confidence in Europe, including experience with parents, adolescents, pregnant women, and healthcare professionals. Without further waiting, Catherine, please start with the first question to our expert.
Yeah, Emily, of course, we are wondering how did attitudes toward COVID-19 vaccination change during the pandemic? I think it's a key aspect for the whole 3 years.
Yes, thank you. There have been quite a lot of changes since the pandemic. And I think what the pandemic really highlighted is how volatile vaccine confidence can be. So what we really saw when we were monitoring confidence levels across the world, specifically in Europe as well, but throughout the pandemic, is that changes happen as new information comes out, as new policies are made, as the context changes. This can either have an increase or decrease in confidence levels in the population. What specifically we saw is that at the beginning of the pandemic, people were worried, they were concerned, and they were hopeful for vaccines. And this translated into high confidence in vaccines and high willingness to get vaccinated. But as the pandemic started to get under the control, as we got COVID variants that were less dangerous, and as vaccines became more effective as well, people started to get a little bit less willing to get vaccinated and confidence decreased. And this is something we saw across the world. So this really puts a lot of questions as to how this will change now that the pandemic is almost over. And for example, for future vaccine booster doses, but also for seasonal influenza, we really need to be careful about how this will change over time.
You're totally right with your comment, and especially for boosters. We may wonder for the next season, not knowing exactly if SARS-CoV-2 is going to be a winter game or a per-annual virus. And at the moment, I am not so sure we know exactly about that. And so we have to be very careful about the next winter time and the acceptance of vaccines. In my environment, I'm much older than you are, so I belong to the older adults, and I see many people quite reluctant to go on with boosters. Probably also it's linked with the decreased surveillance of the disease and a lack of reimbursement of some surveillance that were free of charge previously. Maybe, Joe, you want to comment on that?
Yeah, the first guidelines are right now being shaped, right? And I guess it burns down to just vaccinating those at increased risk, at least with the current variant. If this changes, that may change. But the question, I guess, Dr. Karafillakis, it is difficult to predict the future. Mm-hmm. But if you try for the high risk groups, will there be confidence or will there be less confidence? I mean, these are those who will die, right? There will be, I predict there will be recommendations for those who will die at a high probability. Will there be more confidence or less confidence? What do you predict?
It really depends on the situation and the context and the country. I think it depends on the type of communication that will be put in place to try to motivate these people to get vaccinated, making sure that they understand the benefits of vaccination and preventing these diseases, the risk that they're at with these diseases. All of this is essential. So if countries have a really good preparedness plan for these extra boosters, then it can have an impact on confidence. And we also know that there are age differences in confidence levels. So this could also partly have a role. We know that people in older age groups over 65 tend to be more confident in vaccination than people in the 18 to 35 age group. So this could also potentially mean that people do feel more at risk. So when you do have higher risk of disease, they can understand that and they are more willing, therefore, to get vaccinated.
So I guess we should get ready now for autumn, right? It's always a little bit late, but people should get their act together. Politicians and ministries of health, public health officers should get their act ready for what's going to come. Let's go back to vaccination or vaccine uptake. Did the changes in confidence in vaccines also affect non-COVID vaccination?
Completely. As with COVID, so confidence in vaccination is volatile for other vaccines as well. So any new event can have an impact on confidence and trust. So the COVID pandemic in itself was a very large event that did have an increase influence on people's confidence in vaccines. And we've seen that with now, if you look at uptake rates for the MMR vaccines, for the HPV vaccines, these have all decreased at the same times as confidence has decreased. So it's not just an issue of uptake, it's also an issue of trust. And in recent studies that we've done that are still in preprint, we've seen that actually confidence level can really act as a predictor of vaccine uptake. So if you can detect changes in confidence in certain vaccines in specific communities and countries, that tends to then lead to decreases in vaccine uptake if nothing is done and if people don't react. So what we have to understand, though, is that the pandemic is not the sole reason for these changes in confidence. And actually, if we look at the data, confidence in routine vaccines like, as I said, MMR or HPV started decreasing before the pandemic. So there are other issues that are at play. There are other factors, and this, for example, includes, we know that there's misinformation circulating around vaccines. We know there's a lot more people using social media to research information about health. We know that these diseases like MMR, measles, they're not seen as really dangerous by people, so people are more reluctant to get vaccinated. There's concerns about vaccine side effects. So all of these factors mean that there has been a recent decrease in confidence across different vaccines.
Catherine,
as a pediatrician, clearly there was a decrease of uptake for all vaccines during 2020. Clearly due to lockdowns or restrictions of circulation. It's getting better in 2021, and now on, we have nearly the situation that was back before the pandemic. The second aspect is that we don't know all about transmission of the disease, and so it's very difficult to target specifically those who may be ill and transmit, or those who transmit only, or those trying to protect the most vulnerable segment of the population. My next point is, would you establish a link between confidence, an inverse relation between confidence and the fear of the disease? Because when you evoke this loss of uptake, this loss of confidence previously to the COVID, that's totally true in every country, especially in mine, France. At the same time, we have much less of the disease. So the population is wondering, why do I have to protect myself against a disease that is no more seen in the country? So could you elaborate on that?
Yes, completely. People's concerns about the risk, you can see it as a risk versus risk ratio. It's the risk of vaccinating versus the risk of not vaccinating. Yeah. And it definitely has an impact. So if the public don't see a specific disease as risky, if I can take the example of measles because it's one that's very commonly taken, and we have seen decreases in measles vaccination. If people are not exposed to measles anymore, they don't know how it looks like, they don't know how dangerous, how severe it can be. And that's not just the public, it's also healthcare professionals. We've seen healthcare professionals that are no longer exposed to these diseases and stop recommending the vaccines. So we do have here an effect of people's perceived importance and danger of severity of these diseases, and that does impact confidence. What is interesting, though, is we've seen that using fear as a tool to motivate people is not always effective, and we have to be very careful with that. So people need the information, they need to know about these diseases, but playing with fear can actually backfire.
Yeah, you are totally right. I'm not promoting fear at all, but it exists, and it serves from time to time as an incentive for the population, not only in vaccines. And so you were speaking the right way when you utilized the risk and risk ratio between vaccine and disease. And so speaking about the risk of the vaccine, I was surprised in a very good way from the quality of the pharmacovigilance in every country, in Europe, on a daily basis, and also on a weekly basis with a report of PRAC. And so, at least for healthcare professionals, it could have been a very positive impact. What do you think about that?
Yes, I think it's the scientific risks of vaccines have been clearly proven that are limited and very minor. It's the perceived risk of vaccines that is more tricky. And one of the reasons why this is the case is the difference between what we call active and passive risks. So it's much easier to accept a passive risk, so not doing something, not getting vaccinated, and let's see what happens if we get the disease, rather than an active risk. I'll actually get vaccinated, something in my arm, I'm taking that risk actively. What could happen? What could go wrong? And that distinction is really important to make, because that's psychologically, that plays a very, very big role in how we perceive this balance between risks and benefits, because it's not just about scientific information, it's about emotional assessments of risks. It's about how we assess these risks with our emotional system. That's where it's really, really essential. Yes.
I like the way you frame the notion of risk. I think it's a really pivotal cornerstone of the problem of vaccines and vaccination. Shall we go on the next point? So, in fact, we should elaborate a bit more about any difference by population. What do you think about that?
Well, concerns about vaccines and confidence levels and trust are very specific to different populations. So that's why we're seeing sometimes the same type of information, the same rumor can circulate in different communities. And in some of them, it will pass and not be taken up and nothing will happen. But in others, because of the context, because of the background, because of historical events that have happened and mistrust, there it can actually lead to a decrease in confidence and uptake in vaccination. So the context and the population that we're looking at is essential. And more recently, we've seen this as well since the pandemic with age differences. And that's something I mentioned previously, but we're seeing really a concerning widening age gap in confidence levels. So as people over the age of 65 are gaining more and more confidence in vaccination, and that could be because during the pandemic, they were told that, they were at risk of certain infectious diseases. They understand their risk. They understand that they need vaccination to protect themselves. But at the same time as increasing confidence is seen as in these age group, we're seeing a decrease in confidence in younger age groups, so 18 to 35, 18 to 24. And that's the population, we have to think about, as well as future parents potentially, and maybe new parents that could potentially refuse routine vaccines for their children. So it's important to understand why they're losing confidence. What's the difference between their perceptions and perceptions of other age groups? There's, I think, a range of factors that could explain these differences. Again, they'll be different from one community to another and from one context to another. But some of what we've seen is that, during the pandemic, young generations have been asked to sacrifice a lot, to go into lockdown, to vaccinate themselves, to have these passports for traveling and for all of this, while they were not necessarily the group that was most at risk of COVID. So all of this created a lot of tensions, a lot of mistrust, sometimes in government decisions, and that can really have a long-term impact in how people perceive different health interventions. So that's one important factor to keep in mind. We know about, obviously, other things like exposure to social media. Young people are more online. They're more exposed to rumors and misinformation that circulates online. So there's a range of factors that can explain these differences. But there's a few things we need to think about. Maybe it's about how we frame vaccination, that it's more focusing on who is at risk, and it's across the life. It's not just the elderly, or it can be people across the life course, and maybe that's one way to go about it.
I like the way you say that. While you were thinking and speaking, I was on my side thinking about, should we start a bit earlier during the teens and try to educate and inform and communicate more about vaccination and their role in promotion of health, as well as other measures? I'm very keen to focus on the teens, including from 10 years of age up to 18, because it's accessible to the media, it's very fragile to the media, and so we have to start maybe in this range of population. Joe, would you think about something like that? And Emily, I would like to have your opinion.
Yeah, Emily, why don't you answer the question?
I completely agree. I think we need to start with children, and I think having vaccination as part of the health science course, integrated into something else, can be really make a difference in the long term. There's been initiatives. I know that WHO has developed a game, for example, to teach children about vaccination, but I think schools are also essential in providing more neutral, more objective information, because we did a few studies looking at the role of children and adolescents mostly in vaccination decisions, and they tend to get most of their information from their parents. So if their parents are hesitant, the information they get is most of the time biased. So I think that's a very good approach, and I would actually go beyond that and not just focus on vaccines, but also on how do you look for health information? How do you know what is misinformation and what isn't? Because social media is here to stay. It's not going to anywhere. Misinformation is here to stay. It's not going anywhere. There's no point in trying to block it. It will find other ways to spread. So what we need to focus on is more giving people the tools, empower them, children, to know how to assess information themselves.
Excellent.
The question then would come up if it is useful and ethical to use vaccine mandates. That has been, done by one way or another in different countries. So, what is your view here?
So, from an ethical perspective, that there is a reasoning behind it, that if you make vaccines mandatory, what you're doing is it's for the common good, it's for the greater good, for the community health. And in that sense, people are supposed to give up some of their individual freedoms to be able to protect the overall community. So that's the ethical perspective around that. And it's been implemented for COVID, but also for routine vaccines. So in France and Italy are two good examples of where recently, for example, certain vaccines were made mandatory to try to improve coverage rate. What it did is, with these examples and with COVID, yes, it increased very rapidly uptake rates. But the problem and some of the negative sort of side consequences of this is the impact it has on trust. And we've seen with COVID specifically that once you try to force people, and that's not just the public, but also healthcare professionals, to do something, it can really backfire in terms of the trust they have in official government and the role that health authorities take in health and vaccination. For vaccination for healthcare professionals, for example, they felt like they were being forced, not respected. Their education and background was not being respected, and they were just being pushed to do something by politicians. So yes, it can be a very quick and efficacious way of increasing uptake, and in certain instances it can be beneficial, but we have to think about the long-term impact it can have on trust, because trust takes a very long time to be rebuilt, especially when you're talking about governments and health authorities. So we'll need to start thinking about the impact of that.
So you're right, and that leads us to the next point. The role that did politicians play with regard to vaccination during the COVID period, with their good things and more probably disputable aspects?
Well, politicians have, I think it's politics, but it's also about power. So it's not just the politicians, but it's about the people in power and how they can impact people's beliefs and perceptions by steering conversations. So we're seeing that at a local level with community leaders, with religious leaders as well. So it's not just the case with COVID and politicians at a sort of national level. And it's something we've been following with the very specific example of populist parties, for example, where we've seen that people and countries that tend to vote more for populist parties also tend to have lower confidence in vaccination. So there are certain links here, and one of the explanations that has been given for that is the way of framing that populist parties have of framing, putting the masses, the people, against the elite. And normally in a political sense, that's politicals that are currently in power. But with vaccination, that's the experts. And we've heard so many times in the UK, but also in other countries, about how people are fed up with experts during the pandemic. They didn't want to hear anymore about, the numbers and the expertise and the scientific knowledge. And that's where trust comes in. You need to know more about the people that look like you, people that are in your community, that know you, that feel and behave the same way as you. So we do have a very strong role that politicians have. In some instances, it's also been positive. They have been able to manage the pandemic really well. But we do have to think about the ground that they give for people to have concerns, and it gives an extra justification for them. If politicians start with their power that they have to spread messages against vaccination, that gives people more ground for spreading these rumors and not getting vaccinated as well.
Yeah, you are right, if you allow me. I think, nevertheless, that for this pandemic, it was the first time that Europe, all countries included, were able to federate to buy vaccines in large quantities available for everyone. And it seems to me that, nevertheless, whatever you said, and it's true, I consider it's a very positive benefit. And really, it went well for this aspect.
Yeah. I think in the end, what it comes down to, all politicians, whatever color and whatever direction, they should promote vaccination, because this is public health, right? There is this, you can go this way or that way when it comes to politics, but when it comes to vaccination, it cannot be that some parties say no vaccination. This is, for me, I think this is a big problem. And partially we saw this, right? Political parties saying that they are anti-vaccination. So this is against trust in vaccination. But going along this line, I think in a democracy, we need to live with this, with this spagat, with this two points, right? On the one side, the people can decide and parties are the people, right? And on the other side, public health, we need it for all. We need it for everybody to get the best impact. But maybe you have a view there?
No, I completely agree. I think that, we need to have a little bit of both. And I think there is one of the biggest mistake you can make with vaccine confidence and trying to address vaccine confidence is thinking that this can be sorted by just telling people what to do or giving them, the right information. If people knew about the vaccine safety, if they knew about the benefits of vaccination, they would get vaccinated. It's not at all about that. It's really about giving them the space to have their questions. We're not, talking about stopping them from talking about their concerns. It's people have very real, very important questions about health, about science, about vaccination, and it's important that they have a space to share these and to ask, whether it's their doctors, whether it's people in their communities, but to ask those questions without being judged. That's really essential.
Yeah, you're right. On a global aspect, I consider, and I told you some numbers or percentages in my country, but I think they are quite the same in other countries. It's the role of prevention, though I don't like too much the word. I prefer promotion of health, and a large promotion of health, as you evoked, for the teens especially, because I think it's the way to go forward. Everyone wants well-being, wants aging, wants to keep in good health, whatever the kind of health. So promotion of health is pivotal, including vaccination. It's a very, the tiny part of the global budget for health is for promotion of health. And so would you establish a link between trust and promotion of health?
Completely. I think, there is a need for more investment in the long term. And I think that's maybe one of the reasons why the finance side is lower than for other things, because it's looking at the future, not problems that exist, not something you're trying to treat straight away, where you can see the issue, you can see what you can do, and the results are there straight away. It's about preventing something in the long term. So it's much more difficult to promote, but vaccination has to be part of a wider health promotion agenda. It's definitely essential, yes, and not only for confidence, but if you look at vaccines like HPV, for example, it's not just about vaccination. It's about adolescent health. It's about sexual health. It's not just about health. It's about collaborating with other ministries. If vaccines are given in schools, it's making sure there's collaboration with the Ministry of Education. It's really interdisciplinary, and that's really essential, yes.
Okay, so in this field, where do you see the place for civil society, not only for political aspects? Because the point is that independently from health, there are many opponents to politics. And so we don't have to enter too much of this field. But I would like to promote more actions from the civil society. And if you agree on this point, do you have any ideas how we could do that?
Well, we always say that if we do want to make an impact and improve people's trust, it has to be done at the local level. So it has to be done with the public, with the communities. And the first step is listening. And as I said before, it's giving a role to people to share their concerns, respect them, having empathy for their possible concerns and fears. Once that's done, it's about engaging them. So it's not just communicate, as I mentioned before, it's not just communication. It's not communicating to someone. It's a dialogue. It's having engagement of people in strategies, in political decision making, making sure that we engage them in co-design of intervention, co-development of strategies, and that their voice is heard. So that's one element. And I know that in France, for example, there was a public consultation that was done before the vaccines were made mandatory. I think that's really, really key, the type of structure that's really important. And the other element is also making sure that any intervention is targeted at communities. So it has a lot more impact if people are being in conversation and having these type of conversations about vaccines, if it's with people that understand their community, not someone from outside who's coming in to tell them what to do, but having peers, having other parents, having other whether it's doctors from the same community, but someone they can really feel a link to, engaging with them. I think that's key. So yeah, civil society going back to the to the ground, to the local level is crucial.
Okay.
Well, I guess we're approaching the last two questions, and the first one is the role of healthcare professionals. I guess they have in the end at least largely been those who administer the vaccines. What is the role in vaccine confidence of this group of relevant stakeholders in vaccine trust?
Well, healthcare professionals are the most trusted source of information when it comes to vaccination. So, when individuals have to make difficult decisions and they don't have the scientific knowledge to assess the risks and benefits, for example, of every single intervention they have to take, we tend to place our trust in others. So we ask someone else to make that decision for us. That's the psychological way of looking at it. Healthcare professionals play that role for most people when it comes to vaccination. So whether that's family doctors, GPs, pediatricians, whether that's nurses, midwives, or pharmacists, they all have a very, very important role in people's decision making around vaccination. And this was emphasized during the COVID pandemic as well. We really saw the importance of their discussion with patients. One of the issue, though, well, there's two issues, is that most medical schools in Europe don't have a very large course on vaccination. It's usually a couple of hours, 2 to 3 hours. So healthcare professionals do not have sufficient training.
Yeah. And here I can interrupt you. There is one university in Germany with a vaccinology course, one single one. And everybody else has an hour or two on something that is not in a curriculum. Sorry to interrupt you, but I'm not sure about other countries, but Catherine may know. But in most universities, there's nothing.
No, you are totally right. In France, we have created a long time ago, more than a decade ago, a diploma, but it's a university diploma after doctors or pharmacists or midwives or people working in companies who are interested in vaccines really, and they want to improve their knowledge. Otherwise, everything in vaccines, from immunology to research to implementation to practical aspects to all you said, is scattered along the university course. And it's a pity. It's the reason why I wonder why we have not yet included true knowledge education to the students in medicine. And I think it's the next step. I hope so, but...
Dr. Karafillakis, we interrupted you, but we just, you see that Catherine and I are both upset with the situation, but we interrupted you. Apologies for that, but you finish your thought, please.
No problem. And I'm happy for you to intervene. I think it's really an essential topic, and we are seeing certain, European-wide initiatives to try to change that. We're not there yet, but I think there needs to be a European level recommendation for the inclusion of vaccination in these curriculum. The other element that I wanted to add was that on top of that, healthcare professionals are not most of the time not trained in communication skills for vaccination, and that's another very key element for confidence in vaccination. It's very difficult, especially with the short time that healthcare professionals have when they talk to patients in their consultations. It can be very difficult to know how to address patients' concerns about vaccines. And healthcare professionals are also, we've seen in studies, they don't necessarily all believe they have a role to play in convincing parents. So some of them think that, their role is to propose, but that's it. If patients say no, they say no. Others do believe that, they're there to give information. Others believe they're there to promote health, and that means promote vaccination and try to have a conversation. So this really shows that it's essential that we have a proper training in place, both for vaccination itself, but also for how to communicate to patients with medical professionals.
If you allow me, we have tried to create something in parallel. It's called InfoVac France. It was created by Clarence Sigrist in Switzerland, and it worked very well. And we did the same in the country for 20 years now. And since 20 years, I belong to this. I must say that all doctors, pharmacists, midwives, and even pharmacovigilance centers, or even pharmaceutical companies, are asking any kind of questions about vaccines that they have encountered with the patients and public. And so it gives you a very good idea of what can be made to help. It's a totally independent body. We are several of us, and so we can discuss among us about some queries, questions, and answers. And it's a very positive impact on the vaccines and the confidence of vaccines. So I do agree totally with what you raised. That is, we have to promote more vaccination knowledge among healthcare professionals to make them confident. If they are confident, their patients will be much more confident.
Very good. I think we are almost at the end of our questions. Maybe, Dr. Karafillakis, if you could highlight the main points of your experience from COVID-19 for us to take along in the season to come, the 2023-2024 COVID season. What do you think is most important?
I used to, so in one word, it's preparedness, but I'll explain a little bit. I used to, before COVID, I used to start my talks with a slide of a picture of the wards of the 1918 Spanish influenza pandemic. And I used to say, well, this was 1918, but we don't know when the next pandemic will hit. It could be tomorrow, it could be in a few years, it could be in 100 years. But we're a lot more prepared. We have better vaccines. We have vaccines for a lot more infectious diseases. We have a lot more science to fight infectious diseases than we did at the time. But what if people don't take it? And COVID happened and put us in a very real life test to see what happens. Now, it's very easy to look back and say what went wrong. It's much more difficult to make decisions when you're dealing with uncertainty and things are getting worse and worse. So I'm not here to judge, of course, but what I'd like to stress is there's a lot of lessons to be learned from what happened. And that's not something to shy away from. It's not something to be embarrassed. It's just about, as I said, preparedness. There's so much knowledge in, what happened during the pandemic. One quick example is how we had communication issues with the mRNA vaccine. We had very strong mistrust and a lot of rumors circulating about the use of mRNA technologies. And part of that is because the communication was really focused on, look how quickly we have made these vaccines. It's a miracle. We've created all of these tools to fight COVID. And, normally it takes 10 years. Now we've done it in 2 or in 1. And that was the central message of the communication, because it was about showing, of course, what science can do and how people can be protected. But what that did is that it sort of in a way hid all of the experience that went into these vaccines. mRNA didn't come from nowhere. It came from years of research with cancer and years of research with vaccines and trials and other scientific background that existed, and that wasn't communicated well enough, which means that in the end what people took from this was the fear that these vaccines were created very quickly. Can we trust them? Is it possible that we just don't know enough about them? These were the type of questions. So that's just one example of the type of missteps, mistakes that happened during the pandemic that we need to learn from. We need to take lessons from, so that in the future, when the next pandemic happens, which who knows when will happen, we have a better preparedness plans for communication. And it's not just about pandemic. It's also, as you said, about, what will happen 2023, 2024. It's about making sure that our communication is strong and adapted to the actual issues. But also, to finish on a more positive note, there's also a lot of positive lessons to learn from what happened during COVID. There's so many initiatives, events that showed strong community ties, strong, care for each other, the way that people took care and responsibility and really try to help their communities, and how we can use that to integrate vaccine and health promotion, I think is a very good lesson to keep in mind. How we can work with communities, work with each other to try to protect each other.
I think this was a very nice last comment. Catherine, maybe you want to add something here, or?
No, I think you raised a lot of issues and perspectives, and I like the way you are very keen to equilibrate the positive aspects and the other aspects that maybe can be discussed and maybe worked on for the next episode of pandemics. I no doubt that we will have, but hope people will not forget about it all. My impression is that there is, at least in 2023, a fatigue of pandemic. People want to forget, to go back on their lives and go forward. And so I hope we will be able to do that for some years, not to think too much about pandemic, but I am not so sure of that. It was an extraordinary interview, and really I want to thank you. It was very open-minded, very keen, and very human, and I like your humanity when you speak about vaccination. Joe?
Thank you.
Dr. Karafillakis, same words from me as from Catherine. Thank you, Catherine, for joining us today and for all your questions. With this is the end of our First Global Health Fast COVID-19 special. Today is July 27, 2023. Please like, share, and leave your comments below. Thanks for joining us today. I am Joe Schmitt. Goodbye.
I'm Catherine Weil-Olivier. I'm really very happy with what happened today. It was very opening and very good-minded. Thank you so much, Emily, and thank you, Joe.
I'm Emily Karafillakis. Thank you so much for having me. It was a pleasure to speaking today about vaccine confidence. Thank you. Goodbye.
Goodbye.